So the good news is that there is good news. The good news is that there is hope that these kind of efforts that y'all are embarking on to get the fish going in the same direction. There's been fish in the pond, there's been fish in the ocean, but let's get in the same direction, can in fact reverse the trends that we've been seeing over the last decade at least, if not 2 decades. So when we think about common ground, there are the actors, the players, the elements that are part of whatever drama or whatever circumstance is playing itself out. And as I've thought about this, and when it's, man, it clickered. Holy smokes. There are at least 4 that I've thought about as it relates to childhood obesity. Doesn't mean it's all of them. These are principal ones that need to be part of every conversation we have. If it's about children, parents got to be involved. And one of the things that we're seeing is that those programs that are school-based that engage parents work better than even the programs that are school-based. So parents need to be involved. And what all parents want are their children to be smart and their children to be healthy. And if you're a parent, and those aren't 2 things you want to combine. I'm a parent, smart, healthy. That's what we want. Schools want academically strong. They want their kids to be doing well in school. They want them to be healthy as well. There's nothing worse than a sniffling child in the classroom or a child who in some form or fashion is not as healthy as he could be. Not to say that we don't take care of them, but the degree to which we can optimize health is the degree to which schools are going to perform better, I believe. Employers want a healthy, productive workforce. And I put public safety up there because one of the things that's become clear to me is that part of our messaging and part of fighting common ground is that there's a set of folks for whom parents at school and not even employers is going to be as compelling as the issue that Mission Readiness put in front of us about 18 months ago that says 27% of young people that want to join the armed forces and do something in the name of protecting America are denied that opportunity because they weigh too much. They are carrying around too much weight. Well, I would say to you the same applies to police, fire, EMS, you name it. We want a healthy, well-trained workforce that can do the things that we expect them to do, whether it's fires in Colorado or EMS situations or dealing with hurricane victims. We want that for our communities. Maybe I hit the wrong thing. Is it the bottom? And so, a few statistics, and I'm not going to go through them because you've seen these before. And these are the statistics that go around what is obesity. And we know that we have a issue in our country. We have children who are more and more overweight and obese. There has been sort of a flattening over the last measurement cycle of about 1 year to 2 years. But flattening is good, but where we're flattening at is not so good. So it's good it's not getting worse, but where we are is not necessarily a good thing. And when we look at, as we go through the next 4 slides, and you can just run through them, what you already know is that there are populations within our populations that are disproportionately affected by childhood obesity. And that includes particularly Black and Latino children as it relates to Houston-Harris County. Pacific Islanders are in that category, American Indians are in that category, but in Houston, Texas, the majority of students in schools are Black and Latino children, and they are disproportionately affected by childhood obesity. Now, we know that there's some other factors that probably contribute to that, having to do with some of the social determinants of health, but I'll stick with this for now. So just run through these. And then we'll come to the next slide, which is a little bit about where we are as a state in terms of our health. And you probably saw last week that, you saw last week that in the Houston Chronicle was an article about the AHRQ's national health rankings, and Texas ranks 51st. And you'd say 51st, there's only 50 states. We're worse than Washington, D.C., which gets counted as a state. So we are dead last. These are words from the article. Dead is a word that Dr. Palacio, Dr. Zarin, and I learned. You don't use that word dead when you're a doctor, sort of loosely, even in vernacular, because it's just not a good word, but there it is. Dead last in federal government's latest report card on delivery of health services, falling short on the medical care side of things. Now, that's important because on the health status side of things, we're not doing too well. And so as children who are obese develop things in childhood and in adulthood that they will develop because they are they're carrying around too much weight, the ability of the Texas system to provide care for them is not what it needs to be. You already knew that, but we certainly didn't know that we were 51st in the country. Next. Next is about Harris County rankings. And I don't know if y'all have gone to or seen the County Health Rankings webpage. Do any of y'all raise your hand if you're familiar with the County Health Rankings? So here's something to do, because it's worth it. Just Google the words. I had a friend who worked for Yahoo, now works for Amazon, and every time I said Google as a verb, I got really guilty because I figured I was undermining his job. He doesn't work there anymore, so I can say it. So if you Google the words County Health Rankings, you'll come to a website that's got a huge national map. You can click on Texas and then click on a county, and you will get something that's way more than this. I've been using this little template, a sub-template, for my own purposes. But here's where Harris County stands compared to Texas. On health outcomes, Harris County ranks 53. Adult smoking, lower than the state number, and I would argue that has to do with indoor smoking laws that Houston finally adopted. Obesity is about the same. Uninsured adults is higher, that's a problem. High school graduation is lower, that's a big problem. Child poverty is a little bit higher, that's a problem. Limited food access is actually a little bit better in Houston than it is in the rest of the state. So let's go to the next one. I was a part of the Accelerating Progress in Obesity Prevention, Solving the Weight of the Nation, IOM committee. Steve Kelder and Bill Cole, both of whom are faculty at UT School of Public Health. Steve lived in Houston and bolted to Austin, and Bill's been in Austin. We were part of that committee that came up with some recommendations about how we might accelerate progress. I don't think you'd be surprised by these. Make physical activity a part of everyday life. Create food and beverage environments that ensure that good food, defined by the Kellogg Foundation, is food that's healthy, affordable, brought to you in a just way, and safe, is available to all. Transform messages about physical activity and nutrition. And what that means is that we need to have messaging that counters the barrage of messaging that we get about such things as McDonald's and Burger King and Xbox, you name it, that is not bad. I'm not going to say they're bad. I'm just going to say there's no countervailing messages going on that say here's some things you can do that don't require buying anything. Drink water and play outside. No messaging like that whatsoever. Expand the roles of healthcare providers, insurers, and employers. Make schools a national focal point. Make schools a national focal point. Why? Because children spend all their time in schools. Does that mean that we don't engage parents? Not at all. But as a parent, I go to school all the time to hear about how my kid is doing in school. It is a pathway to parents that's a little bit more natural than virtually any other from an organizational perspective.